Welcome, my dear friends. Welcome. I welcome you all on my Ayurveda Academy YouTube channel. Myself is Professor Dr. Rajendra Raghuvir Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultations or paid online classes of Ayurveda, you can WhatsApp me on 922681060. Today, we are going to discuss about the drowning. And this particular video is more useful for the last year medical students who are going to practice of their own or in their any particular hospital. So what to do if the drowning person who has saved from the drowning? So after that, he has been saved, his life has been saved. So what to do the next regarding the drowning case? Okay, so first aid treatment for drowning. After drowning, we have taken the patient out of the water or the sea. Place the patient prone in the prone position on the hard ground. This is the first step of the first aid. When you take out the person from the flood, because in the rainy season, everywhere there is a flood and the people are getting the problem of drowning. So if you are saving that person and if you have saved that person, so take him out of the water and keep in a prone position on the hard surface. Compress the chest to bring out the fluid from the chest and respiratory tract. This will be your first duty. You have to take the water to fluid from the chest and respiratory tract out. That for that matter, this is the first aid. You have to lie the patient on his back and press the chest, and automatically water will try to come out. Afterwards, after that water has been come out, make him supine. Okay, clear the airway. This airway should be cleaned and pull the jaw forward like this. Pull the jaw forward. These are the special techniques you have to learn from any experts, and then you have to practice at the field. If respiration has been stopped, what to give? Give mouth to mouth respiration. This particular artificial respiration video I have already uploaded on my channel in the playlist of clinical examination. These are fantastic videos of the clinical examination, like nervous system examination, cardiovascular system examination, respiratory system examination. So you please check that video and learn how to do mouth to mouth respiration if respiration has been stopped of that drowned person. If pulse is found to be stopped, give the external cardiac massage. Give the external cardiac massage. Then immediately shift the patient, call the ambulance 108 in the Maharashtra, India. Shift the patient to the hospital where a cuffed endotracheal tube is passed, airway are sucked clear, and artificial respiration is maintained, ventilator, etc., if necessary. So this is all about how you have to do immediately after taking the person out, first aid treatment and shifting the patient into the hospital. Okay, treatment in the hospital. So the new medical students of the last year or internees or registrars, they must know all this protocol of the treatment. If the fresh water drowning case is there, fresh water drowning case is there, that can cause pathology, hemodilution and hemolysis, breaking of the RBCs. Okay. In this case, we have to give injection Lasix to reduce the edema, pulmonary edema, cerebral edema. Injection Lasix 2 ampules intravenous stat. Lasix is a brand name and furosemide is a generic name. Lasix should be given in the hospital. Then injection soda bicarb 100 ml intravenous stat. Stat means immediately after admission. Then if necessary, blood transfusion has to be given because there is a hemodilution. We have to give more cell or corpuscles. Then injection cefazolin. This is antibiotic. This will prevent the aspiration pneumonia because sometimes some water and the contaminants can go into the lungs and there may be a pneumonitis. So to prevent that, immediately antibiotic is started intravenously 8-hourly. Cefazolin 1 gram intravenous 8-hourly. Okay, so 3 drugs should be given to the fresh water drowning case: Lasix, soda bicarb, and antibiotic. Next, treatment in the hospital for the sea water drowning. fresh water drowning, seawater, little bit salted. This can cause pulmonary edema and hypovolemia. Two pathological things, pulmonary edema and hypovolemia. So in this case, to increase the plasma volume, injection Hemsil or dextran, injection dextran 70 cc intravenous in the 500 ml of plasma expander. So it is given mixed 70 ml dextran 70 IV with 500 ml plasma expander. Okay. Injection Lasix the same like the fresh water, 2 ampules intravenous, which is a furosemide, diuretic. It will reduce the pulmonary edema, cerebral edema, everything. It will edema from the body also because water accumulation can take place. Then injection F-Corlin, which is a steroid, which is also anti-inflammatory. Injection F-Corlin, 100 milligram, 2 vials intravenous can be given. Then injection Mefentin, 2 cc intravenous, everything because it is emergency intravenous. If blood pressure is low, that is hypotension, systolic BP is less than 60-70, then Mefentin injection can given to raise the blood pressure. Again, antibiotic injection cefazolin 1 gram intravenously 8 hourly is like a prevention of any aspiration pneumonia. Society education. By this understanding of the drowning discussion, every child must learn to swim. This is a preventive aspect for the society education by the doctors. Insist on parents to make their children to learn to swim in any this type of the mishap or the accidental hazards. Okay. So, my dear friends, all the medicines that I have mentioned, it is only for the educational purpose. Disclaimer, वैधानिक इशारा, कौन सी भी बीमारी में यथावश्यकता काल वैद्यकीय सलाह लेना बहुत ही जरूरत है. Okay, so I wish that you can make a like of this video, share this video, make a thumbs up, and also don't forget to subscribe my YouTube channel and push my activity of sharing the knowledge, intelligence, and experience. And also do not forget to press the bell button icon to get the intimation of the new uploaded videos. I wish all the best. Take care and bye-bye.